Well, a warm welcome to today's talk, Sunday the 6th of August. Now, yesterday we heard the Pfizer hearings from the Australian Senate, and we heard the questions of Senator Matt Canavan to the Pfizer doctors, and we weren't really getting very satisfying answers from those representatives of Pfizer Australia. We were all left feeling, well, I think most of us, certainly me, and read some of the comments, some of the several thousand comments expressing frustration at the lack of clarity in the answers that we were getting. Well, today we're going to look at the questioning from Senator Gerard Rennick, friend of this channel, of course. He starts out briefly by pointing out the lack of testing of various safety aspects of the vaccine. And given that there was this lack of safety testing, why wasn't this lack of safety testing highlighted, presumably so that people could give informed consent when they were vaccinated? But then he deals with that briefly. Then he goes on to myocarditis, asking what is the mechanism? Why is it that the vaccine causes myocarditis? And it appears that the doctors put up by Pfizer Australia didn't know the answer to that very basic question. Now, I'm pretty sure I know the answer to it. And we'll be looking at Dr. Paul Offit, who also seems to know the answer to it later on. But let's first of all look at Senator Rennick's questioning. And just a bit of a health warning, it is frustrating. But Dr. Tharood, the first doctor, the Pfizer doctor, does give evidence that he can read.
According to the Pfizer non-clinical report, there was no carcinogenic tests, no genotoxicity tests, no immunotoxicity tests, no interaction studies with other medicines, no longitudinal studies. And I note that in regards to pregnancy and lactation, that studies were conducted on rats. How can Pfizer say that the vaccine was unequivocally safe without qualifying any risks around the vaccine?
Senator, I don't have that report in front of me, so I'm afraid I can't talk to that. What I can say is that the TGA is one of the world's leading regulators.
Okay. Well, you can take my word for it. I'm happy to table this document. Okay. So it clearly stated that a number of tests were not conducted. Okay, and given that those tests weren't conducted, and I accept it was a short time frame, I accept we had a short time frame, but that doesn't remove the risk that certain risks were not analysed, and you never highlighted those risks when the vaccine was rolled out.
Senator, I disagree with that statement. I think there was a very clear assessment of the benefit risk. The Therapeutic Goods Administration is a very thorough and very competent authority, perfectly able to reach a decision based on data which it reviews.
Okay. So initially when the vaccine was rolled out, myocarditis and pericarditis wasn't a recognised side effect. Does Pfizer understand why the vaccine causes myocarditis and pericarditis? And if not, how then can it guarantee that it's not also injuring other organs? And can you explain the process why the vaccine causes myocarditis and pericarditis?
I'll take that, Dr. Hewitt.
Sure.
Based on our clinical trials and pharmacovigilance data, as well as real-world evidence following the distribution now of billions of doses of vaccine, we retain confidence, strong confidence in the safety profile of the vaccine.
Sorry, Chair, point of order. I've asked, do you understand why it causes, I know that it's a low risk, I'm asking, do you understand why it causes myocarditis? I want you to explain to me why it causes myocarditis. Do you understand why it causes myocarditis?
Pfizer is aware of very rare reports of myocarditis and pericarditis that have been temporarily associated with vaccination.
Well, they're still ongoing for some people.
Senator Rennick, Dr. Tharood should answer the question. Thank you, Dr. Tharood.
According to public health experts and regulatory authorities around the globe, the number of reports of myocarditis remains small.
I'm not referring to the number of reports. I want you to explain to me the mechanism of how the vaccine causes myocarditis. Do you or do you not understand the mechanism of why the vaccine causes myocarditis? It looks to me like you don't. And if you don't understand it, why are you saying the vaccine is safe without qualifying the risks?
So Senator Rennick, I think Dr. Tharood is actually about to get to that point. Whether people agree, whether there's agreement to his evidence or not, is another question for others to make a judgment on. But if Dr. Tharood, if you could again go to Senator Rennick's question.
Senator, all medicines, all therapeutic products and vaccines have benefits and have side effects as well. Looking at the totality of the evidence for Pfizer's COVID-19 vaccine, regulatory authorities, health authorities, experts globally, including in Australia within the Department of Health and the TGA, have maintained that the benefit-risk ratio...
That's not the question that I asked. I asked, can you explain why the vaccine causes myocarditis? Yes or no?
Senator, the benefit-risk
yes
profile...
Yes or no? So you clearly don't understand the pathway, do you? Because you can't explain it. I'm not referring to the cost-benefit analysis here. I'm referring to, do you understand the biochemical pathway as to why the vaccine causes damage to the heart?
Senator, I'm happy to take your question on notice and come back to the committee with whatever information we can provide. I might just clarify, I was not referring to a cost-benefit analysis in my previous response. I was referring to the benefit-risk ratio, and health authorities around the globe continue to recommend the benefits.
This isn't the question that I'm asking anyway.
So really quite incredible, really, that those guys who were put up by Pfizer Australia didn't seem to know what the mechanism was. Now, I'm going to play you a clip from Paul Offit in a minute, the well-known paediatrician and immunologist, vaccinologist. And he'll be giving one view on why this is happening. I'm going to give you my understanding at the moment. Now, my view and Professor Offit's view aren't mutually exclusive by any means. They're probably both true. The degree to which they happen in one individual probably varies. Sometimes it's my explanation perhaps that predominates. Other times it will be Dr. Offit's explanation that predominates. But let me tell you mine first. So these lipid nanoparticles carrying the ribonucleic acid are injected into the arm. And we know that the systemic distribution of these lipid nanoparticles, now when the systemic distribution, that means they go all around the body. So these lipid nanoparticles are going to go through the blood vessels in the myocardium, through the coronary arteries, through the coronary capillaries and drained by the coronary venules. It's going to circulate through the heart. Now these vessels in the heart are lined by a vascular endothelium, living cells. So there's no reason why the lipid nanoparticles won't join up with these cell membranes in the vascular endothelium in the myocardium and the RNA going into those cells. Now what the RNA does is it hijacks the cells or takes over the cell's protein producing apparatus. And then the RNA will cause these cells in the vascular endothelium to excrete this foreign synthesized spike protein onto their surface. So you'll now have cells inside the coronary arteries with this foreign spike protein sitting on the surface of it. And as a result of that, there'll be an immune response, an inflammatory immune response. The body's immune cells will come along and say, heck, that's not supposed to be there. Let's make an immune response to it. And sometimes the T cytotoxic cells will say, well, let's destroy that cell, thereby causing inflammation in the heart. Now, I think that mechanism does occur. But of course, you've probably realised already that if the systemic distribution, this will be applying to everywhere, not just the heart. And that is probably true. So why are we so aware of the myocarditis and pericarditis side effects? Well, I think there's two factors here. One is that if the heart does stop working, it tends to become fairly obvious within a few seconds. The person would lose consciousness, cardiac arrest situation if the heart did stop working. The other one is we can measure troponins. These are a readily available, commonly tested for cardiac marker that allows us to monitor the level of heart damage. So when we see raised troponins, we can correlate that with the myocardial damage because it's a myocardial damage marker. The same could well be happening in a range of other organs. It's just that it's harder to see. The effects could be longer lasting or more deferred, and the markers maybe not quite so readily available. So that's one explanation. I'm a bit surprised those guys didn't seem to know about that. Let's look at Dr. Offit's explanation now briefly as well.
So where are we right now in our scientific understanding? Is there a problematic link between the COVID vaccine and heart inflammation?
There certainly is a causal link between vaccination and myocarditis and pericarditis. No doubt about it. It's unclear why. I mean, it may be, as was actually noticed in 2020, that SARS-CoV-2 virus, the spike protein, mimics one of the proteins on heart muscle cells, specifically the heavy chain of actin. So if that's true, then while you're making an immune response to the SARS-CoV-2 spike protein, you're also inadvertently making an immune response to your own heart muscle.
Now, very interesting. So what Dr. Offit's saying there is, obviously there's a causal link between myocarditis and pericarditis, but the spike protein, which is produced by the vaccination, will cause a particular type of antibody to be produced. And it looks like there might be commonalities in the molecular architecture, in the shape of the protein, of the spike protein, and this actin. Now, actin is part of the contractile protein, so you have actin and myosin inside a muscle. And these are the active contractile proteins. So it looks like if the body is sensitized to spike protein, it may well be sensitized to its own actin as well, causing this autoimmune response. So that's also possible. The antibody or the other immunological defenses generated by the spike protein could start beating up on the body's own actin, as well as on spike protein of invading virus. It's kind of a cross immunity, resulting in autoimmunity. Now, some cases of myocarditis, it could be primarily that mechanism that causes the damage. Other types of myocarditis, pericarditis, it could be the mechanism I outlined that causes the damage. Of course, it could well be a combination of the both, but the point is there are well-recognised physiological mechanisms, and the leading doctors, presumably from Pfizer Australia, didn't seem to know. Unless, of course, they had some other reason not to want to talk about it in that form, but I can't possibly think what that would have been. Surely they'd want an open discussion of the science that was available, but we can only assume that they didn't know. So it's surprising Pfizer didn't put up people that knew a little more about what was going on, given that this is the Australian Senate representing the people of Australia. So I think we'll leave that there for now. Interesting. And do read some of the comments on the last video with Matt Canavan. Frustrating and amusing, really. Well, at least it would be amusing if it wasn't so serious. But thanks today for Matt Canavan and Gerard Rennick. Great to see that some people are actually sticking up for their constituents. Well done, guys. Thank you.